Hey everybody. So this is our second video in this brief series on psychological disorders. And in the first video, I gave you two vignettes to think about what is and what is not normal, and to have you start thinking about how we define normal. So in this video, I'm going to give you two more vignettes. So this is vignette number 3 in the series because we had 1 and 2 in the previous video. So recently there were severe floods in your area, and your best friend lost one of her twin girls in the flood. She returned to work 3 days later looking fine. It has been 6 months since the floods. You've approached your friend to offer support or a shoulder to cry on. She declines and tells you that she is fine. Her eyes are not puffy, her sense of humor is intact. She's able to have fun, get her schoolwork and job done successfully, and overall there seems to be nothing wrong. You're sure that she is not using drugs or alcohol, and believe her when she says that she is not crying or sad when she's alone. So I guess the question here is this normal? She loses one of her babies in a traumatic event, and she is absolutely fine. And let's say you have magic abilities here, so you know that she really is fine. And she's been fine for 6 months. Let's say it was even a year. And there's just no symptoms. There's no sadness. There's no grief, depression. And my question to you is this normal? Or do you have a certain expectation that she would be grieving? That when somebody loses a child, they grieve? And I'll tell you, I would. I have an expectation that something that traumatic and that grief-ridden would have an impact on her. The only time that I might not worry too much about having no impact would be if she was very, very religious and had a belief that her baby had gone to a better place, and her baby was in heaven, maybe in the lap of God, and that she herself would see her baby upon her own death. If she found that comforting and could move on with her life, I would be the last person to A, I wouldn't be concerned, and B, I would certainly not poke at that. So keep that in mind. Just think about that. Think about, is this normal? Okay? And let's look at the fourth vignette here. So your partner's grandmother lost her husband about 5 years ago. Since that time, she's been living on her own. She's a gorgeous garden, which she enjoys immensely. She bakes, plays cards with friends, and goes to church daily. She increased her church going in the past 5 years from once a week to the daily schedule. She involves herself deeply in volunteer work in the community, and she seems to be enjoying her life. You go over for tea, and she shares with you that every morning God speaks to her and gives her directions for the day. For example, God might tell her to go visit a neighbor who is lonely, bake cookies for the church fundraiser, or read to the blind. The injunctions are always of this nature: good deeds. You ask her if she hears the voice of God inside of her head or if it comes from outside. She answers, "It is absolutely from outside my head. It is the voice of God." You ask if you would be able to hear the voice of God if you were present when he spoke with her, and she says, "Only if you are one of the privileged." So, this is yet another vignette where I want you to ask yourself, is this normal? Is there something wrong here, or is this normal? And some of you are probably thinking, this is normal, this is religious, this is, and she gets to have whatever thoughts and beliefs she wants and to do whatever she wants. And some of you might be thinking, that voice of God from outside of her head, only if you're one of the privileged. So I can tell you that my work used to be, before I started teaching at Pierce, I used to go out and on crisis calls for the psychiatric assessment team for Santa Barbara County. And anytime there was a 911 call involving a psychiatric crisis, the police had to call somebody from the team to go out. And I could tell you that I would not be called for this person, or it's very unlikely that I would get a call. And it's very unlikely that I would have gotten a call for this person as well. The woman who lost a baby but is doing fine. And the reason is that there is no problem here. In both cases, there's no disruption, and you could argue that there's no suffering. I'm not sure about the third vignette, about this one that's in front of you with the mother who lost the baby, that there's no suffering. Some of you might be wondering if, yeah, one of these days she's going to blow. Something's going to just break. And that's a possibility. And the other option, there's another option that she just didn't care. And that also is a little disturbing. But there's still no problem in the outside world. Nobody's going to call for an assessment. And the same goes with your partner's grandmother. And the key here is that there is no suffering in either of these vignettes, these last two, these ones that we went over in this video. And the question that I've been asking you has been misleading. I've been asking you the question, is this normal? And it's the question that's wrong. In psychotherapy, when we treat somebody for mental illness or for problems, we're not interested particularly in normal. What we're interested in is human suffering. Is there suffering here that needs to be treated to help the person? Nobody comes to therapy. Well, if they come to therapy to become normal, then the therapist would set them straight that, it's not really a goal. There is no such thing as normal. And if there is, maybe it's not something that you want to be. You want to be yourself, not normal, whatever that is. And what we want to do is alleviate your suffering. And as long as there's no suffering, there's no work here. There's no call. There's no call for help. And there's no place for therapy, treatment, or trying to change a person. So that's what I would like to be your takeaway from here. That what we deal with in the field of psychotherapy is human suffering. We don't try to make people normal. Okay? Okay, and that's the end of this video.